Hi, everyone. My name is Dr. Cadet, and welcome back to another episode of Ascend TV, where we help self-insured employers lower their workers' compensation costs. Today, we're going to be reviewing a case of a 35-year-old nurse who was seen for foot pain. She couldn't describe a specific mechanism of injury, but stated that she had been transferring patients throughout her shift when she began to feel pain in her left foot. X-rays were taken that initially showed no fractures. She was treated conservatively, but over time still continued to complain of pain. She received further imaging that noted a avulsion injury to the distal fibula. Several months later, she was found to be asymptomatic, but for whatever reason was not discharged. The projected timeline of recovery for this type of injury was about 8 weeks, and the projected cost of the claim was $4,700. However, the case was open for over 8 months. So in combination with the claim costs and the reserves that needed to be set aside, so reserves are a bucket of money that the employer sets aside to pay for the claim, this was going to cost the employer over $12,000. So if the patient comes in, you find that they have an avulsion injury, you treat them conservatively, they heal, they come in, they say that they feel better, it is appropriate to go ahead and discharge them, and in this case without restrictions because there were no physical exam findings such as restricted range of motion or difficulty with strength. But for whatever reason, the primary treating provider continued to keep this claim open for several more months despite the patient not having any more pain. So Ascend came in, we did a record review, we found that the patient was actually asymptomatic, normal physical exam, and was cleared to be discharged. And we were able to close this claim within 2 months, saving the employer $23,000 in claim costs, and also saving them the $8,000 of reserves that they had set aside. So in total, the employer was able to save over $31,000. So if you were to take a case like this and you have 10 of those in a month throughout your organization, that could easily cost you $47,000, especially when no one is closely watching the claim to make sure things are progressing as they should. And if you repeat that cycle every month for a year, you can easily spend over $500,000. How much is it worth to have tighter case oversight, just to have someone checking and making sure things are progressing as they're supposed to, and that if a patient says that they're better and there's no physical exam findings, that we're going ahead, declaring that person at maximum medical improvement, discharging them, and closing the claim. Because I'm pretty sure our patients don't like to just come into the clinic just to say hi, right? If they're going to come, it needs to be because we're actively working on something. So if your organization is struggling with closing their claims within a reasonable time frame, check the show notes. Ascend has some resources that can help. Until next time, bye.